Okay, next we're going to do some imaging on the sacrum and coccyx. Now, for this you need to use the smaller image receptor, the 24 by 30 centimeter or the 10 by 12. For the sacrum, you're going to have a 15-degree cephalic angle on the tube. So, set your angle, adjust your bucky so that it is centered, and then you're going to have your central ray enter 2 inches above the pubic symphysis. Now, oftentimes, a lot of times you don't want to palpate down in the pelvic area. And if you recall, the pubic symphysis is also at the same level of this greater prominence of the greater trochanter. So if you want to just palpate the prominence here, then you can have just think an imaginary line knowing that the pubic symphysis is right at that level. Okay, so this would be the area of the pubic symphysis. So we want our central ray entering 2 inches above that. Okay, so this would be our apiaxial of the sacrum. Now, you can either place your right marker on the patient like that, that's indicating that's the right side, or you can place your right marker on the right side of the image receptor. Now, to do the apiaxial of the coccyx, we're going to angle caudally 10 degrees. But our central ray is going to enter at the same point, 2 inches above the pubic symphysis. Now just remember, whenever you change that tube angle, you always want to change where the bucky's at. Okay, so again, just double check where your pubic symphysis is, and then your central ray is going to enter 2 inches above that. Again, you want to mark the correct side of the patient, so you can either put a right marker there or put the right marker on the image receptor. To do the lateral, oftentimes physician just likes a combined image for the sacrum coccyx. I'm going to show you the combined as well as separate images. This is a straight central ray. Patient's going to lay on the right side, left side. Now, I mean, there's nothing wrong with doing a right lateral, but it's hard to see where you're going in at, so that's why the left lateral is preferred. Okay, so adjust your bucky tray since we straightened it back out. Patient is on their left side, so you can place your marker on the image receptor, or if you wanted to place it up here on the patient. Now, when you're doing the lateral sacrum coccyx, you're going to have to palpate the ASIS. So here's the level of the ASIS. So I'm going to center right where my finger's at with that transverse line. Now, this line going up and down, you want it to coincide with 3.5 inches posterior. So I'm going to move that back, and you can see how this brings the light to the very posterior edge, and you see, a little bit of light here directly on the table. But because the sacrum and coccyx curves back, it is going to be in the most posterior portion of the vertebral column. Okay, so right now we're centered right over the sacrum. Now, this will include the coccyx as well if the doctor does want the combined series. So this would include that. If he wants the coccyx zeroed in on, centered over, what you're going to do is just move this down 2 inches. And you will be more directly over the coccyx. Now, some technologists like to palpate the coccyx and, they know exactly where they're at. If you do not wish to palpate the coccyx, remember the coccyx is at the same level as the greater trochanter prominence. So here we are at the greater trochanter prominence, and it's cutting down, and this would be our coccyx area. So just keep in mind, greater trochanter, the coccyx, and the pubic symphysis, all that is lying along the same line. One more thing. Because we are going through such thickness in the patient, it also helps if you put a little bit of lead shielding posterior here. And what that does is that helps cut out the scatter radiation that is bouncing out of the patient, and you have less scatter on the image receptor. So that's a good tip to use whenever you're doing the sacrum coccyx. On real thick patients, if you're doing a lateral lumbar spine, it would not hurt to lay this lead shielding just posterior to the back. You just have to be careful that you do not have it within that light field. But once you lay it here, whatever scatter radiation you have coming out of the patient, this is going to absorb it so that it does not reach the image receptor. Okay.